Good morning. And my name is Leonard Schaeffer, and I'm very pleased to welcome you to today's conference on challenges of end-of-life care in California, although those challenges exist other places as well. Before we begin the program, though, I'd like to thank three excellent organizations who were involved in planning and supporting today's events. First, Cedars-Sinai Medical Center, then the USC Schaeffer Center for Health Policy and Economics, and the National Academies of Science, Engineering, and Medicine. And as you can see, we try to display all of those sponsors. I think the name Schaeffer appears more than anything else, but okay. This conference has been over a year in the planning and making, and it was the brainchild of Tom Prislak, who is the president and CEO of Cedars-Sinai. Unfortunately, Tom could not be with us today because he thought that attending his son's wedding was more important. I mean, you know, what can I say? Hospital administrator. Okay. So he is not going to be here today, but Dr. Peggy Miles, who's Chief of Staff and a member of the Cedars-Sinai Board of Directors, was able to join us, and we're very happy about that. I also want to thank the Gordon Betty Moore Foundation and Anthem Blue Cross for their financial support and for their leadership and commitment in improving end-of-life care. I'm now going to say some important things that were handwritten, I think, by Kukla. But I think it is important that stakeholders come together to discuss ways that we can ensure that people near the end of their lives get the care that reflects their personal values and their personal preferences. Because so many Americans have experienced with end-of-life care, it's my observation that the public is way ahead of policymakers, healthcare organizations, and even the media on this important issue. Many Americans have had difficult experience in the final days of a loved one and who they saw did not get the kind of care that they wanted or needed. For many patients and their families, their most pressing needs are social and psychological, not medical. Surveys show that most people would prefer to die at home in what they consider to be safety and comfort. They want palliative care, and they want social and spiritual support. With over 10,000 baby boomers a day turning 65, the pressure to identify, to document, and to deliver end-of-life care that reflects the patient's values and preferences will accelerate. In addition, when we look across our country, the cultural diversity of our nation requires improved patient-clinician communication. Providers can't anymore make assumptions about how different people want to end their lives. The fundamental problem, though, is that our healthcare system was not and is not designed to deliver care that's consistent with patients' preferences for the quality of life they may want at the end of their lives. Instead, we have a fragmented system with perverse financial incentives that contribute to uncoordinated care, avoidable hospitalizations, and in many cases, unnecessary costs. Delivering the services that people want near the end of their lives will be challenging because it requires a systemic change. We have to pay providers and others on the team to elicit continuously and document appropriately the kind of care that patients want as they reach the end of their lives. Then we have to deliver and pay for the care that honors those values and those preferences. The good news is that some progress has been made in the last few years to improve end-of-life care. At the federal level, there's new Medicare policy that allows CMS to reimburse physicians for end-of-life counseling, which can be provided as often as necessary, and it allows CMS to reimburse nurse and social worker visits during the last week of life. In addition, there's been an increase in the introduction of bipartisan federal legislation to improve advanced illness care and to encourage advanced directives. You'll learn more about this progress at the national level from Dr. Phil Pizzo at lunch today. At the state level, California continues to maintain its reputation as a bellwether state when it comes to advancing health care delivery. Later this morning, you'll hear from the California Department of Public Health Chief Deputy Director for Policy and Programs, Claudia Christ, who will highlight several public and private sector efforts to transform end-of-life care. Ms. Christ will describe the Let's Get Healthy California program, which is a public-private initiative to promote innovation that helps people take charge of their own health across their lifespans, including the end of life. Finally, in addition to hearing from national and state leaders, we're very pleased to have Elizabeth Bailey, author of the Patient's Checklist, to provide the program's important perspective, the voice of the patient. Today's program is geared toward collaboration and action. For this reason, the Planning Committee decided on a format that includes multiple breakout sessions. And later today, someone will explain where those sessions will occur. They've also limited the audience to about 110 people to ensure meaningful and productive discussion. So if you got in, you got to be a first-rate people. Okay? The breakout sessions will explore issues in 5 areas: challenges faced by the care team, advanced care planning and communication, meeting the needs of a diverse population, new models of care, and policies to meet patient values. Your participation in these breakout sessions is critical because the goal of this conference is to identify an action-oriented list of priorities in each policy area and to identify the appropriate stakeholders that should be involved to bring about changes in each of those key areas. To begin our program, let me introduce Arthur Stone, who is the director of the USC Dornsife Center for Self-Report Science. Joan Broderick, who is the associate director of the center, was also planning to be with us, but unfortunately she can't attend due to a fall. We will miss her, but I'm happy to report that a full recovery is well underway. Dr. Stone is an expert in the collection of valid, self-reported data that can improve our understanding about how people answer questions about themselves. So, for the next 30 minutes, he will make you and me the subject of his research. Good luck to us all.